Anemia is one of the most common blood disorders, affecting millions of people worldwide. But what exactly is anemia? How can you recognize it? And more importantly, treat it effectively? Let's talk about everything you need to know about anemia. What is anemia? Anemia occurs when your body doesn't have enough healthy red blood cells or hemoglobin to carry oxygen throughout your body. This can result in symptoms like fatigue, weakness, and pale skin. Red blood cells are like tiny delivery trucks that transport oxygen, and hemoglobin is the protein that loads the oxygen onto those trucks. When something goes wrong in this process, anemia develops. Types of anemia? There are several types of anemia, each with its own causes and treatments. The most common is iron deficiency anemia, caused by a lack of iron in the diet or blood loss. Then there's vitamin deficiency anemia, often linked to a shortage of vitamin B12 or folate. Another type, chronic disease anemia, occurs when long-term health conditions affect red blood cell production. Knowing which type of anemia you have is key to proper treatment. Signs and symptoms? So, how do you know if you have anemia? Common symptoms include extreme fatigue, pale or yellowish skin, dizziness, and shortness of breath. More severe cases might cause irregular heartbeats or even chest pain. However, many symptoms can overlap with other conditions, so it's important to consult a doctor for proper testing. Causes of anemia? The causes of anemia vary widely. Iron deficiency anemia is often due to poor dietary intake or blood loss, such as heavy menstrual periods or internal bleeding. Chronic conditions like kidney disease can also reduce red blood cell production. In some cases, anemia is inherited, such as in sickle cell anemia. Understanding the cause is the first step in finding a solution. Diagnosing anemia. To diagnose anemia, your doctor will likely order a blood test called a complete blood count or CBC. This test measures various aspects of your blood, including hemoglobin levels and the size of your red blood cells. In some cases, additional tests may be needed to pinpoint the underlying cause. How to treat anemia? Treatment for anemia depends on the type and cause. Iron deficiency anemia is typically treated with iron supplements and dietary changes. Vitamin deficiency anemia may require B12 or folate supplements. If anemia is caused by chronic disease, managing the underlying condition is crucial. In severe cases, blood transfusions or bone marrow transplants may be necessary. Always consult with a healthcare provider before starting any treatment. Preventing anemia. Prevention is always better than cure. You can reduce your risk of anemia by eating a balanced diet with plenty of iron, B12, and folate-rich foods. If you're at higher risk, such as during pregnancy, your doctor may recommend supplements. Regular checkups are also important, especially if you have a chronic illness or a family history of anemia. Anemia is a manageable condition when recognized and treated early. Follow Vigor Moves for more expert health tips and life-changing insights to keep you thriving every day.